You're listening to the Biohackers World podcast.
Hi, I'm Sheanah Rivers.
I'm Dr. Cyntia Brown.
And we are recording live from Biohackers World. Let's get into it.
Okie dokie.
So, Dr. Cyntia,
Yes.
First of all, I love this amazing getup. Very Texan of you.
Very sweet.
Here for it.
Yeehaw.
So welcome to Chicago.
Thank you.
Your resume is stacked. You've got biochemistry, pharmacy,
Genomics.
Genomics, see? Yep. What pulled you into focusing on women's health and fertility specifically?
So to be honest, I did all of that to learn about how to conceive. To be very transparent, most of my education has been in how to have a baby, take care of my baby, and provide for my family. So all of that was a means to an end. And understanding how things like my genetics, my race, what I'm putting into my body will impact my ability to keep a baby and conceive and carry to term. I have a lot of family history of miscarriage. I have a lot of hormonal issues in my family. All my sisters and I all have different hormonal problems, whether it is ovarian cysts and fibroids, very, very early puberty, or bleeding-related issues around our periods. So I knew that something is happening in me that might risk or threaten my ability to get pregnant. So I went to school for 13 years to make sure I could have my baby. That's honestly.
So did a doctor tell you that you couldn't conceive before that, or you were just like planning just in case?
So I, like a lot of people in our community, ours being, Black people, would avoid my doctor and only go when I needed to, if I needed to. I began to have bleeding and pain for years that I ignored because I was like, if I look at this, something might happen. Like they might tell me something that I don't want to hear. So I ignored it until about age 26. I decided to be brave. 24. And I went in for a checkup because I was in too much pain. And they found a bump. And that doctor was like, this is beyond my scope. I need you to go to someone else. So I went to 3 doctors and they found a cyst on my right ovary. And she was like, oh, it's super small, don't worry about it. And I was like, okay, how big is it? She was like, it's about the size of the ovary. And I'm like, I have a cyst on my ovary that's the same size as the ovary it's attached to, and that isn't a problem. I feel like we should do something about that.
Right.
And so that sent me down this rabbit hole of being painfully aware of them, because I kind of busted the bubble of ignorance. And learning about, because I am Black, because I'm African, I'm actually more at risk for cysts and fibroids. Because of my family history, my sister's histories of all these hormonal related issues, something is happening with us genetically in our bloodline, with our racial group, with the way we're living, with how I am. And at that point, I'm entering about age 26 now. I was pre-diabetic. And I'm like, again, because I'm in grad school at this point, so I'm learning. And I'm becoming more and more aware that I can't just kind of deal with this in 10 years when I care about it, because it might be too late. At that point, I'm also hypertensive. My average blood pressure is in the 160s. I'm about 200 pounds, and I'm not very tall. And I'm like, okay, so I'm stacking the deck against me. And I don't want to wait until someone else tells me that you're not going to be able to do this. I already know, because I've learned enough by now, that diabetes, that high blood pressure, that the weight, that the fact that I'm having sleep apnea, I'm waking up, I'm fucking dying in my sleep.
Yeah. Will you explain what sleep apnea is to people who aren't familiar?
So it is essentially where you kind of stop breathing when you're sleeping, and you wake up because your body's like girl, we dying. What's going on? But, and there are several risk factors for it. One being obesity, but it's where like the airflow is disrupted when you're sleeping.
And your practitioner didn't encourage you to lose weight to address those things?
Their primary thing was just take this birth control and it'll shrink the cyst. I'm like, cool.
I feel like that's been their approach.
Well, honestly, even with that, I was put on this expensive new birth control that had come. I was on low estrogen when it was new at the time. And I could not afford it. So I was like almost $200-$300 a month. And I'm in school, I'm in college at this point. And I don't have $300 a month. I'm barely making that's like 2 months of groceries at the time. And so I actually had to use coupons, and I got it through like this nonprofit that sent it to me, I think, for $50 a month. So I had to find ways to even get the medication that was supposed to help me shrink the cyst.
Instead of addressing it at the root.
Exactly. Well, I didn't know that was an option. Honestly, I didn't think that was a thing. At that time, it was just do what your doctor tells you to do and shut up and be happy. Take your pill, take it every morning, don't miss a dose, or you won't be able to move past this. I didn't know that there was much else I could do, to be honest with you. And it wasn't until we went into our women's health section in school, and I was like, wait, like pharmacy school taught me some of this stuff. But my conventional like OB and MD didn't tell me.
Right.
So when I started to learn about it in school, I began arguing back, like, well, actually, like, not to say that I know everything, I'm a student, but I know a little bit enough to advocate for myself to a certain level, and that's been a problem with me ever since.
Or the right problem to have, though. And that brings me to this part, too. I talk a lot about sovereignty and healing and having authority of your own journey and your choices. Your work is deeply science-based, but it also centers personal power. So how do you define sovereignty in the context of fertility care?
Well, I think, I always tell my clients that this is your path. I work for you. I'm just a tool. So we will go wherever you want to, and I want to see you through. I'm not trying to just get you pregnant. I want to see you through postpartum and what that looks like for you, however we choose to get there. Now, I think sovereignty first starts with knowledge. Here's where we are. Here's what we're facing. Here's the good news or any bad news. Here's what I think, and then you making truly informed decisions, so that you're more empowered with knowledge about your own body and what your life can look like, and then you can write that journey for yourself. I'm just simply a passenger, and I'm just happy to be here. I'm blessed and lucky that you let me be part of this conversation with you. So I think just reminding people that they're in charge. And I don't think that patients or clients hear that enough, that they are empowered and that they have control over their bodies, their outcomes, and the journey along the way. You are not just a passive client, a passive passenger along your own health journey. No, you are in charge here. I'm here to serve you.
Would you say, or do you find in your industry, as you're growing your client base, that you have more or less of a particular race, or you help more
So
than others?
I work with a lot of women who have PCOS, ovarian cysts, and fibroids, and I think just the math of it turns out to be a lot of Black women. I think that perhaps, I'm just guessing, we don't ask this question, but I think it's because they see me as another Black woman, and there is a level of inherent trust and comfort that comes with someone who looks like you, someone who's been through what you're experiencing, and I think almost like a insider, I've been to the rooms and here's what happens. One thing I talk about is, hey, for a lot of Black women, especially as darker women, we're typically low on vitamin D, and that deficiency can feed fibroids. Have you been tested for your vitamin D levels? I'm like, no, I had no idea that there was a link between vitamin D and like fiber production.
Right.
And I'm like, yeah, and literally by nature, because we are darker skin, it's going to be harder for you to get that when you go outside. So you might need to supplement, you might need to change your lifestyle a little bit to get more sun. I certainly have had to. There's also a link between like vitamin D production and like depression. Mm-hmm. So I'm like, is it just depression, or do you need to go outside?
Yeah. I ask that question all the time. Yes, I tell people, please go outside.
Literally.
Go outside, the right kind of outside.
Yeah.
Because there's 2 different kinds of outside. I mean, you need both, but touch some grass from time to time. And you have the brilliant model, decode, reset, optimize, conceive. Can you walk us through that? Like what's happening under the hood with someone with PCOS?
Sure. So that is a 4-phase system that I created based upon what I learned on my own fertility and health journey. That took me about a year to where I could conceive my baby. And so now I bring it down into just 6 months, because you don't have to do the trial and error and do it by yourself the way that I did. Mm-hmm. So it's more streamlined, it's more directive, and at every point we are measuring, we are testing, and we are trying to not only, for one, decoding. So you're coming to me, you have this diagnosis or you suspect PCOS. Something that a lot of people don't know is PCOS is genetic, and it runs on both sides, male and female. So you can carry genes for PCOS from your father as well as your mother. So if your sister has it, I'm very interested in what's going on with you too. Mm-hmm. So maybe you don't present in the conventional way and you meet every criteria for a diagnosis, but something could be happening. So let's have that conversation.
Right.
So upon the decode, we're figuring out what's happening under the hood. There's a lot of testing. I use primarily the Anido to test your markers, because it's a pretty simple at-home device that you can use to measure your levels really every day throughout your cycle. But I want to especially see where your levels are around your period and when you're supposed to ovulate, if you're ovulating. As you know, with a lot of PCOS women, they don't ovulate regularly or at all. And I want to figure out, okay, where are you in that spectrum? Are you ovulating, and then getting you ovulated if you are not more regularly and predictably. We also look at, so because I'm a PharmD, I look at your medications, what's helping you, what's hurting you. I look at your supplements, because not all supplements are made equal. So maybe what you're taking has not been third-party tested. It is not actually bioavailable, and it's junk. I find that, like, it's probably junk. Mm-hmm. Throw it away. Mm-hmm. You're wasting your time, and we need to get you something that's going to actually help you and give you the building blocks to build that baby. And then we go into like nutrition and lifestyle. I require movement. You need to move. I want some blood flow. If you don't want to move, we don't need to talk, because what are we doing? And then we go into resetting. Depending on where you are in your cycle, I have some protocols that are meant to help. Like if you come to me and we see, okay, you'll be ovulating next week to this day 1, let's start right now. So I want you taking this regimen made for you, for your body, starting immediately. Let's try and catch that baby right now. Mm-hmm. And then we'll shift our focus to preserving that pregnancy. Because I don't want you to wait the full 6 months to try and get pregnant. We are tracking at every point, because I'm sure, as you know, egg quality and sperm quality can take about 3 months to really change. Mm-hmm. But that doesn't mean that we need to wait. Let's try and capture it and help your body keep the baby too, because I have a lot of clients who have had recurrent losses. Mm-hmm. And so I don't want you to wait. I want you to get pregnant sooner. I tell them, like, I want you to block my number. Okay, I want you to not
rely on me all the time.
Yeah, no, I want you to be like, I'm already knocked up, girl. We're done. Yeah, the sooner the better. I don't want you talking to me in 6 months, actually. So let's try and get pregnant faster, with some guidance using our device. So we'll know when the ideal day is for conception. Like I'm going to brag for a moment. Like, I've gotten to where, like, I will screenshot my Anido tracker and be like, do you want to have a kid this month, honey? And he'll be like, I don't know. Maybe
not today.
Right.
Yeah.
You know, because we're that regular. And I want you to do that too. Like, do you want a Gemini baby? Like, I don't know. Maybe we wait.
Not that one. Not that
right.
Maybe another one.
Exactly.
Let's get another
Capricorn. That's what I want to get you to.
Yeah.
Then we go to, of course, resetting. So we are changing how we're interacting with nutrition and food. I require a full detox, no sugar, no caffeine, no carbs. I'm strict. You're gonna hate me. I don't care. You're gonna love me when we get you that baby, but it's gonna hurt a little bit, and I need you to trust me and give me those things that are inflaming your body, that are disrupting your ovulation, that are messing up your insulin. I just be pissed at me, and I have had some people look at me like, "What you mean? I can't. You can't have the coffee. I'm sorry."
Yeah.
But we're realistic, and I will say, "Look, okay, today's Friday. I'm gonna give it to Monday. Do what you gotta do.
Get it out your system.
But on Monday,
then we get to work.
Yeah, and I will get on the phone with you. Let me see your pantry. Just make sure.
I love it.
Just to make sure.
I love it. That's
I'm
the kind
nosy.
of coaching I would need, though.
I'm
like,
nosy.
Give me, yeah.
What's that box over there?
Yeah. Yep. Get rid of it.
Because I'm like, I don't care about making you comfortable. We are trying to get pregnant. And these are the things I did. Like, I went on a binge before my cleanse. I was like, I'm not going to see you for a while. I ate my Oreos, my candies, and I was like, I'm done. I want my baby. And I didn't eat sugar for almost 2 years. So I'm not saying anything that I did not do. And of course, with all that work, we then go into like optimizing and conceiving. Because at this point, one, your insulin levels are regular, so your body feels safe enough to ovulate. Something I really harp on is the insulin, especially because with sugar, it's pro-inflammatory, so your body feels as though it's on fire. And your brain isn't gonna release that egg and be like, why would you release a baby into a burning building?
Right.
You know, so I wanna get that under control. So I really focus heavily on insulin balance, make sure that we are, especially with PCOS, so making sure that our body feels safe enough to even ovulate. And then at this point we're moving, so a side effect of proper caring for your body and movement is going to be weight loss. I don't care how much you weigh, honestly. Big girls get pregnant every day with ease, so I don't really care. But it might happen. Just look out for that if you care about that. Whatever. And then we are, conceiving, because at this point, hopefully our husband is also on board.
I hope so.
You would be surprised.
Yeah, that's fair. That's fair.
But my system is very female focused with materials and modules for your male partner. But I tell him, like, I work for you. If he's willing to be there, I love that. But I got tired of dragging husbands along, to be honest. Sometimes they just didn't care. Sometimes they didn't want to change anything. Sometimes they were like, well, I passed my sperm analysis test, I don't care. And I'm like, that test is kind of graded on a scale, and like, it's not actually indicative of your ability to help preserve this pregnancy. So I am like, if he will join us, I will have him, but you need to get your house in order for this baby. So I work for you. I will incorporate him. There's materials in our programs for the men, but I'm not gonna fight him. I fought enough husbands. I'm tired.
So in your framework, I will point out, or not point out, but one of the I know you talked about movement.
Yeah.
But one of the things that I talk about with clients, even those who have had trouble conceiving, is the importance of creating.
Yeah.
Is that something that you recommend with your work, that in order to help them conceive?
Are you talking about like writing, journaling?
Whatever, like creative muscle they use, yeah.
So I'm gonna tie in a little bit of emotional and spiritual health with that too.
That
Naturally, as we are going, it's an emotional process. It's a hard process, and like for me, I envisioned my baby for years before he was conceived. I knew I wanted him. I wrote to him even before he was conceived. So much of my life has been dedicated to my child, even before I had him. And I wrote to him throughout my pregnancy as well.
That's
so beautiful. I have
beautiful.
journal entries of, like, I felt you today, and this is how mommy is feeling. And I encourage that with all of my clients. We have journals as part of our modules too, where I will say, let's pause and reflect a little bit on how and reconnect with our bodies. I am science driven, but it's also powered by soul. And I think that's really important.
Okay. I'm going to ask one other question that I love asking everybody.
Yeah.
What's your medicine? Like, what fuels your soul to keep going with this kind of work, with biohacking, with helping women that you help? What's your medicine?
I think just remembering how scared and weak I felt before, and how I don't want anyone to feel as alone as I did. And so I just try to remember, there are women like me who are dedicated to their future baby, and that is my ministry. He's my ministry. He's the proof of everything, and I want to help shepherd other women into motherhood like that. So I try to remember my why for doing all of this, and that puts a battery pack back in me. Hey, there are future babies to be had, that we are just one little barrier, one conversation away from them being part of this story with us.
I love that. Thank you so much. Thank you for your time.
We love the Biohackers World. We really loved it in LA. We love it here in Chicago, especially because this is a new market that's opening up now. And then Miami, of course, was phenomenal last year, and we're looking forward to this year on November 1st and 2nd, which will be an amazing event. I think it's going to be huge and really exciting.